Nigeria. And it's good that sometimes we laugh. This morning we were laughing with Barrister Darlington, but we're here to discuss another very pressing issue, and that's our bodies, that's our health. It started last week, like almost a series, a mini series. We were talking about diabetes, the complications, and every other thing that we needed to know, right? Okay, so today we're continuing with that because we found out that there's so many messages that came after the show. If you were not able to direct these messages to the platform that we announce to you all the time, this is another opportunity for you. Or if you directed those questions there and we were not able to answer them, I'm talking as if I'm the doctor now. They were not able to answer them. Yeah, this is another opportunity, but keep it short and simple and be as fast as possible so that we can cover that in the 25 minutes or so that we have. We have in the house our usual guest, Dr. Charles Adeogun. Good morning and welcome.
Good morning, sir.
We also have the doctor that was in the house last week and he has come back again, Dr. Dayo Adegite. Welcome to the program.
Thank you. It's my pleasure.
Okay. Let's assume that there are some people who did not join us last week. Let's start with a basic definition of what diabetes is. At some point in our lives, diabetes was called a big man illness. Whether you heard it or not, but I did hear it. When you are diabetic, that's a big man sickness. There's some illnesses that are designated like that by the local folk that may not even know that they too can get it. So let's start with the basic definition, Dr. Charles.
Okay, thank you. So diabetes is a metabolic disorder that has to do with how your body breaks down and utilizes sugar. So basically when we eat, especially carbohydrate foods, our bodies break it down, process of digestion, into sugars, and everybody has a temporary spike in their blood sugar after meals. But there are certain mechanisms that control blood sugar that make sure that it remains what it's supposed to be because there are optimal levels of normal blood sugar. But in certain cases, this mechanism is disrupted either because the insulin that is needed to drive sugar from the blood into the cells where they should be utilized is either deficient or insufficient in amounts. In some people, it's not even produced at all. So you can have that as the insulin-dependent diabetes. And in some other people, insulin absence is not the problem. It is actually a problem with the insulin working properly or the body responding to the insulin properly. So you have this kind of situation where people have what we call insulin resistance, whereby, the sugar still remains, elevated. And there are some risk factors that are associated with diabetes, basically, and we'll still be talking about them in depth. Then there's also the gestational diabetes, whereby a woman who is pregnant would notice that in her pregnancy, she's having sugar spikes that were not previously there in her non-pregnant state. So these are all the potential types of diabetes that we can have. So we have the type 1 diabetes, which is the insulin-dependent type, or the juvenile onset type that happens in children. Then you have the non-insulin dependent type, that's the type 2 diabetes. Then you have the gestational diabetes. So basically the problems that arise with diabetes is just the elevated sugar, and the complications that we see are due to the sugar not being controlled over a period of time. So it has effects on various organs, from the eyes to the kidneys to the heart, to the nerves, causing erectile dysfunction in men, causing delayed wound healing, and possibly amputation of people's limbs too, in extreme cases. And then you can also have circulatory problems in general because it also damages the blood vessels. So you can see that the sugar being elevated over a long period of time can cause major complications that are really, really life-threatening or even incapacitating in some situations. So it's very key that people go to get screened, especially when there's a positive family history or where they are overweight or where they have a sedentary lifestyle or they drink alcohol a lot. All these things are very, very key areas where people should always have their sugar screenings done. And it's also important that, we should let people know that when you're managing diabetes, it is not only about your medications. You also have dietary and lifestyle changes that go with them. So you can't be eating just anything. Your diet must change significantly to be eating foods that will not spike your sugar. And then you are on the right drugs and you are doing a constant monitoring. But there are some symptoms that give away diabetes. I'm sure the diabetes
Yeah,
specialist will talk about that more.
we're still at that introductory stage. Dr. Adegite, let me come to you right now. As you, I'm sure you're dying to add to what he has said, but the definition kind of gives you a feeling that those who have sugar, a spike in their sugar, whatever, how you're explaining it, are the ones in danger. We also know that there are people who have low blood sugar. Does it mean these people can never be diabetic?
So maybe just to define what low blood sugar is.
Because the layman just knows high blood sugar, and he feels those are the people that can get diabetes. There are people who have low blood sugar and they can never get diabetes. Is that what it really means as
Yeah,
you're trying to?
so if low blood sugar is what truly low blood sugar means, because it depends on what you call low blood sugar. So what you call low blood sugar could actually mean blood sugar within the normal range. So as long as, some people have low blood sugar, and the causes of low blood sugar are also many. Some drugs can cause low blood sugar. There are some other condition called Addison's disease, where you have low level of cortisol. So virtually everything, if you flip what causes high blood sugar over, you can actually have low blood sugar. For example, if there's low level of cortisol can cause low blood sugar, while in the same way, high level of cortisol also can cause high blood sugar. I don't know if that helps.
Basic thing is that nobody is safe if you are not moderate in your lifestyle. Is that what you're saying?
I think the body has a way of moderating to ensure that our blood sugar is within normal range. So all these hormones, he did mention one, which is insulin. There are other hormones, we call them counter-regulatory hormones.
Okay.
So that means they counter the action of insulin.
Yeah.
So when insulin level is high, do you understand that the blood sugar goes down? When the counter-regulatory hormones, when they are low, the blood sugar also goes up. So, but when they go high, the opposite happens. So basically what you have is that the body has a way of moderating to ensure that we have the level of the insulin that we need, and also the counter-regulatory hormones level also within the normal range. And that's what keeps our blood sugar within the normal range. So the body created by God works in so perfect way to ensure that even when we are awake or whether we are asleep, our blood sugar is maintained within the normal range.
Okay, he mentioned some types of diabetes, and one of them is the one you have as a child. Yeah, okay. So, and there are others. So let's have an in-depth explanation into those ones.
Okay, so over the ages, the definition of diabetes has evolved. So in the early 50s, 60s, they used to use the age of development of diabetes, or the age of onset, to define the types of diabetes that you have. That was when they talked about juvenile, for those who are young. Of course, they found out that those people, they tend to require insulin for survival, not just for blood sugar control. They need insulin for survival. That means without insulin, they're going to die. Then they have the maturity, what they call the maturity onset. That means for people who are a bit older, then they made these two classifications. They said the juvenile onset, the maturity onset. But then later somebody will wake up and say, wait a minute, why should we be using age to define it? What exactly is the problem here? We realize that this group of individuals, they require insulin for survival. The maturity onset, they don't necessarily require insulin for survival. Then they say, okay, let's focus on what they needed, which was insulin. So then they said, okay, let's say non-insulin dependent and insulin dependent. So insulin dependent were those who were juvenile onset. And those who did not require insulin for survival, they said non-insulin dependent. Then towards, before the end of the millennium, around 1997, thereabout, the WHO set up an expert committee, which they reviewed again. They looked at all of this, and they said that it was wrong to classify people based on whether they require insulin or not, because indeed, those maturity onset, some of them will require insulin at some point.
Yeah.
So they said, okay, let's focus on the cause, or what they call the etiology of this disease. Then they said, okay, so what are the major causes? They realized that there is a particular type that is as a result of autoimmune disease. So this type is called type 1. Again, these were those who predominantly were the insulin dependent. Because what happens is that there is an antibody that attacks the pancreas, a particular tissue within the pancreas, and destroys it. So once more than 70 to 80% of these cells are lost, they develop symptoms. And they tend to have a
You're
very
describing
dramatic...
the juvenile now.
Pardon?
You're describing the juvenile now.
Type
No,
1.
yeah, the so-called juvenile,
Yes.
the old juvenile. Of course, those nomenclatures have been abandoned. Nobody talks about juvenile anymore because we now know that those so-called juvenile, majority of them are actually type 1 diabetes. I don't know if you understand. So, of course,
So if
Yeah.
these people get it that young in life,
Yeah.
it means majority of them inherit it, or would you also attribute that to a lifestyle that has caused that?
Absolutely not. It has nothing to do with lifestyle. Type 1 diabetes are driven largely by genetic, they inherit it to a very large extent. There must be some genetic component to most non-communicable disease have some degree of genetic contribution.
Okay.
Then, of course, other environmental factors. So environmental factors in them is the fact that there is an autoimmune condition that predisposes them to developing this condition. So what happens is that in the etiological or the development of type 1, it's believed that these children were exposed to some proteins early in life, maybe milk, as something like milk, or some infection. Maybe they had infection even during when they were in their mother's womb or in the early life. And then the body recognizes that protein or whatever it is. It could be milk, it could be infection, recognizes it as as an assault. And then it keeps the memory after he had weathered off the infection or whatever it was. Then it keeps the memory. Then later in life, when the body sees anything that looks like that initial assault, it attacks it.
So it never forgives.
Unfortunately,
It never forgives at all.
unfortunately, the cell, the beta cell, we call it the beta cells, within the pancreas that produces insulin, seem to look like that protein. The body recognizes that, oh, this looks like what the attack I had maybe like few months ago, several years ago, and begins to attack it, and it destroys the cell. And of course, the insulin tank depletes. Once it goes beyond 70 to 80% of depletion, the person begins to develop or manifest with symptoms of diabetes. Now, because they have total almost zero insulin or very little insulin left, their symptoms tend to be very, very dramatic. They lose a lot of weight. You can't miss it because they lose a lot of weight, they pee a lot, and then, of course, once they go to the hospital, it's something that can easily be recognized.
Dr. Adeogun, is any of these categories of diabetes treatable on the one hand or avoidable?
Well, for the genetic causative factors, you can't do anything about genetics. So if you carry the gene, that's it. Or if you have autoimmune disease, unless something drastic is...
When you're talking about genetic, you carry the gene and you cannot avoid it, does it mean anybody in that line is likely to have it? Or there's a lifestyle you can live from early in life that could help you at least last longer before you get it?
Well, that's what I mean by saying if it's genetics, genes are so powerful because they contain, generational material, so to say. These are things that you pass down from generation to generation, and it's like a constitutional makeup. There's nothing you can do to correct that. So once somebody is genetically predisposed to something, excuse me, it will most likely manifest. But for people who have...
Sorry.
Yeah, thank you. But for people who have, a diet that cannot... I think we call them what's the word now? the glycemic indices of the food they eat is not so high, dietary and lifestyle modification can be helpful because there are certain foods that spike your sugar more than the rest.
Yeah.
So if you are eating low glycemic indices food, you can find out that your body will be able to maintain the sugar levels more optimally than it would if you were just eating like the general population. And then also, we've also found out that people who do less of alcohol, is also a plus for them because alcohol has been linked to pancreatitis because the pancreas, like the doctor said, is the main organ where insulin is secreted from. So the more alcohol you take, you are likely to damage your pancreas and you are likely to have diabetes as a consequence of that. Then, of course, people that are overweight too, they are more likely to have insulin resistance. So insulin resistance is strongly associated with obesity. So when we say people are obese now, it is not just that their frame is big or they have a lot of body fat. They are also going to have issues with metabolism of sugar and high blood sugar levels. Then, of course, we also have noticed that...
Is everything fat obesity?
Well, obesity is when you have a lot of visceral fat, and that is fat that surrounds your organs. It can infiltrate into your organs and ultimately damage your organs, just like fatty liver. A lot of people think fatty liver is only associated with alcohol. Yes, alcohol is one of the chief culprits of causing fatty liver, but being overweight too can cause fatty infiltration of the liver that over time, as the grade of fatty liver increases, you can start having liver function impairment.
Is there a possibility that someone who is not physically big can have that infiltration to the organs that you're talking about?
It's still very possible based on lifestyle. It's still very possible. But we're saying that there are a lot of strong associations in medicine, strong associations. So when there's a condition, they will tell you that this condition is strongly associated with these risk factors.
Yeah, I needed that out because some people might just look at their body and say, okay. I'm not obese.
If I may just add to what...
Go ahead, please.
So he actually mentioned something that you need to take very seriously. He mentioned visceral fat. So these fats are within the organs, the fat parts around your liver, around the hearts, around even the kidneys. So these are the bad fats. They are the bad fats actually that are responsible for the insulin resistance. What happens is that when these fats overgrow after some time, some changes occur in them, and they begin to produce some very toxic, we call them some inflammatory markers. These are the things that actually alter the receptor on the tissues that makes them insulin resistant. So it's possible for you to look someone on the outside and say, okay, you are not so big, but they may have visceral fat. They may have fat within their organs. No matter how little it is guaranteed that that individual may have insulin resistance.
So what do we do to find out whether this fat is growing or not growing in us? So that we avoid those things.
Abdominal scan can help you. I mean, especially the liver. Then there are other scans, other different kinds of imaging procedures that you can do that actually quantify how much fat you have in the different organs of the body. But beyond that, there are other things you look for to find out whether somebody has what they call insulin resistance. There's what they call acanthosis nigricans. So if you look, it's usually behind the neck. You will see that thing will look velvety and darkish, and it has this darkish and velvety, very appearance, and sometimes under the armpits. So that alone is a very strong marker of insulin resistance. Sometimes tiny tacks around the skin could also be an evidence that somebody has insulin resistance. So it's beyond just that somebody is big.
Okay.
So you may be apparently look normal weight, but you may still be insulin resistant.
Okay, so let's just quickly go into what to avoid, the lifestyle that we need to change, the lifestyle that we need to adopt and all that, because some messages are coming in and our time is almost up. You can't believe that. Okay, so what are those things that we do maybe unconsciously that spike up this? We need to know that alongside what we need to avoid, because if you tell us what spikes it, automatically you're telling us to avoid it as much as possible. Please, let me start with
the main factors that normally spike sugar is eating a lot of carbohydrate foods. In Nigeria, for instance, our foods are mainly carbohydrate foods. So I think I've seen people eat just bread and drink Coke, and you're wondering what's the combination? What kind of combination is that? So you're just spiking your sugar unnecessarily. You're making your pancreas overwork unnecessarily. And then over time, you may find out that the beta cells that secretes insulin have been overworked over the years. Then secondly, a lot of people are overweight. They know they are overweight, but they keep giving excuses. We are all big in my family. That's how we are.
We have big bones.
We have big bones. I've been trying. I've actually tried, but there's nothing I can do about it
Doctor, hold that thought. Let me ask you a funny question. Does something like bitter leaf control sugar?
at all.
Because that's the myth that a lot of people
No,
think.
that's not true.
You
Because
begin to drink bitter leaf.
that's just thinking positive and negative will cancel out each other, which does not work in real life. It doesn't work in medicine, so it doesn't work at
Go
all.
ahead, please.
So, like we said, excess carbohydrate foods, taking a lot of sugary drinks, sedentary lifestyle. A lot of people, they say my work, is so busy. I don't get to move around. I just sit down 7 a.m. till 5 p.m. Your body was designed to move. If you don't move around, you don't use your muscles. Your muscles too would use up the sugar, and help you. So exercise is mandatory for everybody. Exercise is not only for people who are obese or overweight. Exercise is healthy for everybody. So if you don't move, if you're sedentary, you're likely going to have sugar-related problems. Then, of course, a lot of people that drink alcohol, that binge on alcohol, lots and lots of it, you may damage your pancreas, not to talk of the effect it has on your liver and on your heart as well. So it's very important that alcohol should be done in moderation. If possible, stop drinking alcohol in the first instance. Then, of course, you also have a lot of people who, for some reason or the other, they are on certain medications that can spike their sugar. If you're on a medication like steroids because you're managing some other things, please let your doctor monitor your sugar closely. Because if you're on prolonged use of steroids, you will have your blood pressure going up, you have your blood sugar going up, you may have weak bones, you may have weakened immune system, you may be prone to cataract. A lot of things can come from that. Then, not to talk of people who are athletes that abuse steroids because they want to perform better. All these things are, all the factors that we should really, really consider. So, but most importantly, I think if you have a strong family history, just be on the lookout for these things. Because if you have a parent or sibling living with the condition, just know that you already have an asterisk on you.
You were born with a minus. More or less. Okay, let me come to you, Dr. Adegite. But when you have a sedentary lifestyle, like he mentioned, what is more dangerous to do? Going back from work to rest, and then going back from work and still trying to exercise. What would you advise somebody? Because they would say, okay, I've been working throughout, I'm tired, let me go and rest, I will get myself back. Some other person might say, okay, because you've been sitting all along, even if you're tired, you should still exercise. Are we between the devil and the deep blue sea, or there's one that we can choose and be safe?
Well, it's a very difficult decision to make, especially in a working adult with very busy week schedule. So what I always advise my patient is that you have to be intentional about your health. If you don't, somebody is going to make you not to take your health seriously. So be intentional include, instead of driving, take a walk to short distances. Then when you go to work, let's say you join public transport, instead of dropping at the nearest bus stop to your house, you can drop about 3 or 4 bus stops away so that you can walk. So you need just at least average of about 30 to 45 minutes of walk every day, of brisk walk, at least about 3 to 4 times in a week. Do you understand? That should suffice. I mean, it's enough for you to at least reduce your risk of developing type 2
Are there no
diabetes or
exercises that you
getting
can
overweight.
do while sitting down that can still aid the blood circulation and
When
every
you are
other thing,
sitting
and the
down,
muscles and all that?
Unfortunately, there's none.
You have to move.
You have to move.
You have to move.
So our ancestors, and you should have asked why diabetes. Our ancestors were moving, the hunters and so they moved. Do you understand? And they didn't eat all the time. So the reason for diabetes is that there are quite a number of reasons. So our ancestors were always hunting, looking for the next meal. When they eat in the morning, they know they need to find something.
They'll
and
go
they-
to farm, they'll do a lot of
Yes.
things.
So-
Possibly that's why it's a big man's illness, as they said. Because I think the people that they began seeing so much of this with are the people who had office jobs. They started sitting, they started driving, and feeling that they were so big, and they didn't go to farm anymore, they didn't trek anymore, and all that.
If I may jump on that. So there's what we call the thrifty gene hypothesis. So thrifty gene says that those who were brought up in resource poor areas, who when they were growing up, the amount of calorie had was low, probably because they were brought up in poor resource settings. So when they get older, maybe they get a job, and then, so you remember they grew up not having enough food to eat. So they suddenly have a good job, a good paying job, they have plenty of food around them. So the body recognizes the fact that when you didn't have enough, there was a problem. So when you now have more than enough, even when you eat just enough, that enough is too much for your body, because the body saves the extra.
Voila,
And that's why your chances of adding weight
Yeah.
is very higher, and the chances of diabetes is much more. In the Western world, it's not so. So in Africa or in poor resource countries, yes, I agree with you that diabetes is commoner among the higher social economic status. But in the West, it's not so. It's actually poorer among the poor in America. Why? Because they have access to junks. They don't eat healthily. So the statistics or of who gets this in the West and Africa or in poor resource countries are completely
Okay,
different.
that brings me to another thing. Now, in Nigeria, at least, this is the country I know. In Nigeria, people no longer eat, at least majority of them, no longer eat out of necessity. They eat for status. I'll explain that. You go to a place where they have fast food and all that. People want their kids to eat junk, the ones you're calling junk, just to show that they have the resources to buy for them. That's status eating, not necessarily because it's healthy. So speak to this. Let's hear what kind of danger could come from exposing your children to junk, especially at the early age. And the earlier you expose them to those things, the more attached to those things they become, even when they grow old. So let us know the danger now, so that those people who are listening will know that showing off that you can afford some things also may be that you are comfortable, you can afford a coffin.
We call them chubby, cute children. But now,
Sometimes we even call them healthy. You look healthy.
We are beginning to see. Remember, we said that the type 1 diabetes tend to occur more commonly in the early life.
Yes.
Usually, the peak of type 1 is about 10 to 11 years. But now, we are beginning to see increasingly and frighteningly so quite a number of younger people developing type 2. Type 2 used to be the disease of after you are 40. But now I'm seeing 10. Yeah, I'm seeing 10, 11, even less developing type 2 diabetes because of these reasons that you've talked about. Many parents think they need to spoil their children because they grew up not having access to going to Mr. Biggs of this world, to Tantalizers, but they don't know that they are causing problem for their children. So we need to, and I think the government also needs to do a lot, as it's been done in the West, where now the quantity of sugary things that children can take, now they're actually minimizing it. There's a lot of adverts, even by these companies, by Coca-Cola in the West, in America, against eating too much of sugar. So all of these initiatives and policy direction need to be taken seriously by our government.
Okay. Let's see if we can rush over some of these messages that are coming in. Okay, Nyamgul, please ask the doctor. My friend did a hernia operation since last 2 weeks. Up till now, the scrotum is swollen and the surface is not healing as expected. What is wrong?
Okay, well, that is something a general surgeon does, but if you still have some swelling there, it means that there's still some inflammatory process going on, and it depends on the type of hernia. Sometimes you have what we call inguinoscrotal hernia. Sometimes you have just the basic inguinal hernia. So it may be that this type of hernia is herniating into the scrotum. You have to be sure that the surgery was completed correctly. And then also, if you have wounds that don't heal on time, I would believe that certain screenings would have been done prior to the surgery, including the sugar that we're talking about, because you may have delayed wound healing if your sugar is not right. And then another thing is, how is the wound care? After surgery, post-surgical management involves still maintaining aseptic conditions around the wound, because infected wounds may find it very difficult to heal. You may have prolonged, healing process and all that. And how compliant is the person with antibiotics and the rest of them?
Okay. Can high blood pressure result in hypertension, and what are the signs of it?
High blood pressure and hypertension are synonymous. They are basically the same thing. It's just, using two words to say the same thing. Your blood pressure is elevated beyond what is considered normal. And unfortunately, there are no symptoms. It's usually symptomless.
Okay, Dr. Adegite, this one is saying, I have joint pain. I don't know the cause. What could cause joint pain?
Well, yeah, quite enough. Well, I mean, it could mean that you knocked your knee against something.
Okay, that's a
It could,
possibility.
well, depending on the age, osteoarthritis, rheumatoid arthritis. So there are quite a number of things.
And depending on which joint you have, because
Yeah.
sometimes you may have multiple joint pains. Is it a
Yeah.
specific joint? Is there swelling of the joint?
Yeah.
Is there obvious abnormality or deformity of the joints? Those are the key things to
What if
look
there are
out for.
no abnormalities, no swelling and all that, but you feel that?
Then just like the doctor said, it could be rheumatoid arthritis. You can have your immune system attack your joints also. And then you could also have malaria. As simple as malaria can also present with joint pains. And even if you're not sleeping well, you can actually have
Yeah.
joint pains. So and it depends on the kind
But
of
can
work
it,
you
if,
do too.
for
Pain
instance,
is a
what if it is on the
non-specific-
knee and it is only one knee? Is
if
that
it's
possible?
one knee, yeah, it could still be osteoarthritis.
It could still be
especially for
arthritis.
people who are overweight. Because when you're overweight, when you're obese, you put pressure, loads on your, bearing on your joints.
So
and
the
it could
person
start
needs
with
to
one.
investigate it.
It could start with one and progress to the other
Yes.
one later. Yeah.
Okay, so this one is saying, good morning. What could be the cause of, maldigestion? That's what it says. My tummy became big and not always free.
Well, you can have all sorts of things cause that. You can have what we call your intestinal flora. There may be an imbalance there, so you feel bloated all the time, and you feel that you feel full. You eat a little and you are full already. So you need to find out from a digestive specialist what the real issue is. Then you can also have some food intolerances. It could be lactose intolerance. It could be gluten intolerance. There are certain food allergies that make people feel bloated. And then you should also get screened for things like H. pylori. Find out if you have some kind of peptic ulcer related issues, because that can also let you have a lot of gas in your abdomen.
Okay, Steve Ikelu is saying, Doctor, how true is this myth that sex is the best exercise?
Well,
I thought none of you wanted to answer.
I don't know about best, but I mean, sex is a good form of exercise.
Okay.
It tests actually your tolerance. It does, and it also helps you for your
Without
cardiovascular-
enhancers
your
anyway,
cardiovascular
right?
health.
Without enhancers.
But it's not necessarily the best of exercise.
Okay.
It's not necessary.
but it is an
But
But
exercise.
it's a form of exercise.
For the man or the woman?
For both,
For both.
actually.
Really? Okay. Okay. Thank you. Let me see if we can get one. Okay. Okay. Since this one just sent in a contribution that is not maybe related. And I think that should be it, because we have overrun our time by like 4 or 5 minutes.
So let them just send their questions to us.
Yeah.
The questions
Please give us the.
so you can
social
you
media.
can send to Doctor's Mike, DR capital DR apostrophe S MIC. So you can throw more questions either on diabetes or what we've talked about today, and you can have access to us.
Say
And
that
then
again.
Doctor's Mike. Doctor is title DR. So DR
Can also be
apostrophe
debit anyway.
S apostrophe S, then
Yeah.
MIC.
Okay.
Mike, so that we can help you with your questions or your comments, or if you need further guidance, we'll be able to direct you to the right quarters. You have access to us via that link.
Okay, so anybody who sends a message there will have it answered.
Yes, we'll
Right.
have it answered.
Okay. Now, thank you very much. This is how much we can go. Like I said, we've already overrun by like 5 minutes. Very wonderful. Dr. Charles Adeogun, thank you so much for your time this morning.
Thank you for having me again.
And we also are very delighted to have had you, Dr. Adegite. Thank you very much for
Pleasure.
coming.
Thank
All
you.
right. Okay, you heard the doctors. Go to where you have been directed to and ask all your questions that we may not have answered here today.